back. If you just joined us, you're watching the news at 10, live on Channels Television Lagos. A reminder of our top stories. Federal government confirms 10 new cases of coronavirus in Nigeria, bringing the total number of confirmed COVID-19 cases in the country to 22. Mixed reactions trail federal government's restriction of international flights into the country as the Nigeria Civil Aviation Authority announces closure of Lagos and Abuja airports to international flights for 1 month. Lagos begins enforcement of social distancing as Italian index case of COVID-19 is discharged from the infectious disease hospital in Yaba after testing negative for a second time. And North Korea fires 2 projectiles into the sea. South Korea says it's monitoring the situation. Plus, business, sports, and international news. Our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android TV, Fire TV, and Roku. And we're staying with the COVID-19 issue. The Lagos State Ministry of Health says passengers aboard British Airways Flight 74 and KLM Flight 587 are exposed to confirmed cases of coronavirus. The ministry further revealed in its Twitter handle that the 2 flights arrived at the Murtala Mohammed International Airport on Wednesday, that's March the 18th. It has asked the concerned passengers to observe strict self-isolation and reach out as soon as possible to prevent community transmission of the disease. The Nigerian Railway Corporation, that's the NRC, has stopped all passenger train operation as from Monday, that's March the 23rd. In a statement, the Deputy Director, Public Relations, says that the further information on passenger train services will be made available in due course. In the meantime, the Director General of NAFDAC, Professor Mojisola Adeyeye, has been clarifying her comments on the use of chloroquine as a possible cure for COVID-19, insisting that it's been approved for only clinical trials and not for public use. She made the clarification on Channels Television today following news that Nigerians were already panic buying the drug. The NAFDAC boss made a strong appeal to Nigerians that chloroquine, which was banned in the country years ago because of its malaria parasite resistance, can be dangerous to health if taken without prescription or outside a controlled environment.
Yesterday, what I intended to bring out is that there are clinical trials that are going on in China, in the US, involving chloroquine. Clinical trial is clinical trial. It's not something you go and say, it has been prescribed for me to be using routinely. And I emphatically said yesterday that you cannot, or you should not go out and buy chloroquine if you are not in any clinical trial or if you have not talked with your doctor. Okay. The Ministry of Health, the Honorable Minister of Health, is directing the updates and the affairs of COVID-19. And people are taking it the wrong way in terms of rushing. And all this rushing came before I spoke yesterday. Chloroquine was discontinued many years ago because of the fact that the parasite developed resistance to the drug, which means people can use it and it will not work. That was why we turned to combination anti-malaria medicines. However, actually, before I go to the however, and NAFDAC has been doing post-marketing surveillance, mopping out any chloroquine that is on the market. Because monotherapy doesn't work. We now have combination.
To add to that, a professor of medical microbiology at the Ahmadu Bello University Zaria, Bola Olayinka, wants Nigerians to take the issue of social distancing seriously, which she says can greatly reduce the level of COVID-19 transmission. In an interview with Channels Television, the infection disease control expert also lent a voice to the panic over chloroquine, saying self-medication with the drug cannot prevent transmission.
What we need more is getting people to understand why, if, for example, you just traveled in from outside the country, why you need to keep to yourself for 2 weeks. That is responsible behavior. It is wrong for someone who came in and to mingle with people, because sometimes you begin to shed the virus even before you have symptoms. So we need to get people to understand what is the prevention message, what is their own responsibility socially to prevent transmission. Yes, it's good to do research. There's a research aspect to any epidemic. But what we want is, we do not want numbers to escalate in country like it's happening outside. And to do that, chloroquine is not the answer. It's prevention. What are the prevention? These messages have been going on. 1, social distancing. 2, if you've recently come in, keep to yourself for 2 weeks. And if you have symptoms, do not rationalize them, do not hide away. Come out so that you are identified and you are treated. You know, just for many diseases, if you identify the disease on time and you start treatment early, the recovery is good. If we look at statistics, it tells us that 85% or more are mild cases. Some are cases that may really not need treatment per se. When I say treatment per se, that refers to giving people drugs, but more of isolating people so that they do not infect others. One thing that we have learned from COVID-19 is the fact that it's highly contagious. That means that it spreads rapidly, it spreads efficiently. And the way to deal with it is to break that chain in transmission to prevent the spread from one person to the other. Chloroquine isn't going to do that for us. It's those messages that have been passed. If people would just abide by them, that's what will do that for us.
Now let's go back to an earlier story we brought you about the number of social gatherings in Lagos. The Lagos state government has corrected that and insists that it remains 50 people and not 20. So the number of people at social gatherings should be 50. And the state government announced this through the Ministry of Information and Strategy, mentioning that the Lagos state government has banned all religious or social gatherings of over 50 people within the state. And it will ensure that the Lagos State Police Command enforces this directive. So it remains 50 people and not 20. Staying with COVID-19 matters, the Minister of Water Resources, Sulaiman Adamu, is urging Nigerians to embrace personal hygiene, especially at this time when the world is dealing with this virus. The minister told journalists in Abuja after a walk to mark the 2020 World Water Day that Nigerians must wash their hands as many times as possible.
With this serious threat of coronavirus, we felt also the need to complement the efforts of the federal government in highlighting the importance of personal hygiene and sanitation. As you are aware, my ministry has been in the forefront campaigning against open defecation, and every year we also do the World Hand Washing Day, all in an effort to try to promote sanitation. And there is no better time than now for people to be serious about personal hygiene and sanitation. And we felt that even though it's about climate change, but we also need to bring in the issue of sanitation. The Federal Ministry of Water Resources is saddled with the responsibility of coordinating Sustainable Development Goal 6, 6.1 on water supply and 6.2 on sanitation. So that's why it's imperative for us to also highlight the importance of sanitation because water is life and sanitation is dignity. So we're using this day to incorporate a message on the need for us to be, for Nigeria to be open defecation free in line with the campaign that we've started, and for people to wash their hands at critical times. You all know the critical times, going to toilet, eating, and all that. That we've been doing, what we've been telling people every year. So there is no better time than now for people to be very, very conscious about their personal hygiene and sanitation.
Outside our shores, Singapore, Finland and Mauritius report their first coronavirus-linked deaths as the world continues to battle the deadly pandemic. Leaders around the globe are asking their citizens to stick to the rules, and authorities demand social distance rules be obeyed, telling shoppers to be responsible amid panic buying.
Act responsibly. There's enough food for all. That's Britain's stance from the Environment Secretary, George Eustice, who is pleading with UK shoppers not to panic buy.
The Prime Minister and I have spoken to the retail sector. There is more than enough food to go round, and our food supply chain is able to expand production to cope with increased demand. Even though Britain's biggest supermarkets, Tesco, Sainsbury's and Asda, imposed limits on purchases of pasta, toilet roll and long-life milk, alarmed shoppers have stripped shelves bare to hoard for possible isolation in the coronavirus outbreak. Police roadblocks around Italy have increased controls on the population after the worst day since the outbreak that recorded over 600 deaths on Friday. Italy says the further draconian restrictions on public life is a desperate effort to halt coronavirus infections, after the death toll leaped by 627 in a single day, by far the biggest 24-hour rise recorded anywhere. Spain is another country that has been hard hit by the virus. The number of people who have died is now up to 1,326 in total, a rise of 324 in one day. Friday's rise was 235. In Germany, the streets are almost empty as public life grounds to a halt in Bavaria. The authorities also construct temporary border fences to limit the spread of coronavirus. Coronavirus cases in Germany have passed 20,000, and so far 70 people have died. In the Middle East, Iranian President Hassan Rouhani discussed additional measures to combat the spread in a cabinet meeting on Saturday. All attendees were seen wearing face masks. Iranian Foreign Minister Javad Zarif was seen wearing protective gloves as well as a face mask. Rouhani, however, wore neither. A number of U.S. states have ordered shutdowns, with 1 in 5 American soon set to be under a stay-at-home order. New York State has ordered non-essential businesses to close as the mayor says the city is now the epicenter in America.
I hate to say this, but it's true. We are now the epicenter of this crisis.
Globally, more than 275,000 patients have tested positive for the respiratory illness, and more than 11,000 have died.
Meanwhile, the U.S. Vice President Mike Pence and his wife, Karen, will be tested for the coronavirus after a staff member in his office tested positive. His office had announced on Friday that one of its members, who had not been at the White House since Monday, tested positive for COVID-19. He reiterated that neither U.S. President Donald Trump nor himself had direct contact with the staff member and that health authorities have already traced his contacts. President Trump has already tested negative for coronavirus. News at 10 returns. Central Bank of Nigeria says new foreign exchange rate of 380 naira per dollar represents price adjustment and not devaluation. That's on Business News. Join us again.